Movements of glenohumeral joint, shoulder joint. Flexion and extension. So the pectoralis major, clavicular head, and deltoid, clavicular and anterior acromial part, responsible for flexion at the shoulder joint. Deltoid spinal part is related with extension of the spine of scapula. So the spine of scapula where deltoid is attached, these fibers are responsible for extension moment. The acromial fibers of deltoid are responsible for abduction. Now, what about the adduction? For adduction, the role of pectoralis major and latissimus dorsi is important. For the medial rotation, the subscapularis is important. The lateral rotation, the infraspinatus muscle is important. Remember, for the medial rotation, subscapularis muscle. For the lateral rotation, infraspinatus muscle is there. Tensors of articular capsule important to hold head of the humerus against the glenoid cavity. Okay, so the subscapularis and infraspinatus both important. For the downward dislocation, resistance for the downward dislocation, the shunt muscle deltoid is very important. See, the range of abduction. Okay, the total range of shoulder abduction is 180 degree. Abduction up to the 90 degree occurs at the shoulder joint. Further 90 to 120 degree occurs as humerus is rotated laterally. So the 120 to 180 degree range is added by lateral rotation of scapula. 90 degree on the shoulder joint, 90 to 120, humerus is rotated laterally, and 120 to 180 lateral rotation of scapula. Supraspinatus initiates the abduction and causes initial 15 degree of abduction. Okay, supraspinatus 15 degree. Deltoid 15 to 90. Deltoid is the main abductor from 15 degree to 90 degree of abduction. Humerus is laterally rotated by the infraspinatus and teres minor muscle. And the next overhead abduction 90 to 180 degree is carried out by two muscles, trapezius and serratus anterior. Supraspinatus till 15 degree, deltoid 15 to 90, infraspinatus and teres minor for lateral rotation, and 90 to 180 because of trapezius and serratus anterior. Okay, humerus and scapula movement ratio is 2:1 in abduction. Okay, for every 15 degree elevation, the humerus moves 10 degree and scapula moves 5 degree. Okay, abduction at the shoulder joint involves rotation of clavicle also on its longitudinal axis, which occurs at the sternoclavicular joint and acromioclavicular joint, and this contributes about 60 degree of the rotation to the clavicle in total. Okay, during abduction, trapezius and serratus anterior causes lateral rotation of scapula and glenoid cavity. Okay, so the glenoid cavity faces upwards. Yeah. For the protraction, the serratus anterior is